antimicrobial resistance. And this is a huge issue where with the overuse and misuse of antibiotics,
NDMCRE have surged more than 460% in the US.
There's been an over 40% increase in infections, common infections that cause
AMR occurs when microorganisms such as bacteria evolve to resist antimicrobial drugs, especially antibiotics. Although AMR is often viewed as a healthcare issue, it is also deeply connected to environmental pollutions, urban infrastructures, and climate-related disasters. In Santara, several environmental drivers contribute to the spread of AMRs, such as hospital wastewater discharge and pharmaceutical manufacturing effluents. However, one of the most important drivers is flooding and sanitation failures. During flood, untreated water, polluted runoff, and resistant bacteria spread rapidly through communities and waterways, especially in densely populated urban areas.
To address this issue, our proposed strategy combines first, advanced oxidation processes to treat wastewater, and second, hospital management and surveillance to reduce unnecessary antibiotic prescriptions, and last, mangrove restoration to reduce flooding, polluted runoff, and strengthen climate resilience. In this strategy, we estimate a total budget of $10 million. About $4.6 million will go for hospital improvement, 3.6 will be used to support wastewater treatment, and the last $1.72 million will go toward mangrove restoration. Together, this approach creates a more sustainable solution to reduce AMR,
while protecting both public health and the environment.
To combat this AMR-rich industrial wastewater, we proposed a $3.6 million intervention aligning with WHO guidance for strict source boundary concentration limits. By installing modular advanced oxidation process unit directly at industrial plants, we degrade antibiotic residues and active pharmaceutical ingredients before they being discarded to the main river. This targeted stream approach mirrors the EU's PILS project, demonstrating that eliminating residues at source is the most effective way to halt the spread of multi-resistant bacteria. For financial viability, we replicate Dr. Reddy's Lab award-winning green cold water management strategy. We will track success by measuring antibiotic residues against predicted no effects concentration and verifying resistant genes reduction by genomic qPCR. While AOP requires an upfront investment, it bypasses a multi-billion-dollar infrastructure overhaul, delivering a healthier, more resilient Santara. However, to address the remaining 80% of pharmaceutical residues in wastewater, according to the PILS project, we need to address the consumer habits, prescription practice, and proper drugs disposals.
In the 90s, Sweden's trauma model proved AMR is a management challenge. To lead Santara out of this silent crisis, we're launching the SRAM Act, a $2.3 million 4-year investment benchmark against WHO global standards. We begin with a $400,000 to unite health, hospital, and livestock sectors under one commission. This powers a $1.3 million Sentinel surveillance systems, tracking 8 hospitals, 15 farms, and 5 water sites monthly. This data isn't just for labs. It's the power supply for a restricted antibiotic list and targeted livestock regulations. Our final $600,000 built an indestructible national database. We are turning years of harvested data into a trackable foundation, ensuring our future policy is driven by longitudinal reality, not snapshots. While the $2.3 million is a major commitment, inaction costs more. A surge in superbugs that render our medicines useless. By year 4, SRAMs would deliver a measurable reduction in antibiotic misuse through a fully functional, internationally aligned One Health system.
Hospital stewardship programs are systematic initiatives designed to ensure the right patients receive the optimal drugs, dose, and durations. Currently, the overprescription of broad-spectrum antibiotics, often intensified by public health crises, create a conflict between immediate care and long-term efficacy. To address this, a $2.13 million program is proposed, measuring on three strategic pillars. First, by allocating $50,000 to improve clinical precision, hospitals can delabel suspected penicillin allergies. As seen in Australia, many patients falsely report allergies, forcing the use of suboptimal alternatives that drive resistance. Second, a $25,000 annual dosage report can minimize unnecessary volumes, reducing both cost and the development of antimicrobial resistance. Finally, $50,000 should support tele-stewardship systems, providing remote expertise to resources-limited facilities during emergencies. Ultimately, these investments allow hospitals to monitor resistance patterns in real time. By narrowing the range of drugs used, we preserve the efficacy of our antibiotics arsenal, ensuring these vital resources remain effective when they are truly needed.
Talking about the research program, it's cost around $1.15 million over 4 years for auto-enricher technologies and $380,000 for doctor ethical testing and upskill training. A major cause of antimicrobial resistance is that antibiotics are often prescribed before doctors know the exact infection. Since laboratory tests can take 24 to 72 hours, patients may receive antibiotics just in case. This can lead to unnecessary use of strong or broad antibiotics, which increase bacterial resistance. To solve this, we plan to use auto-enricher, an advanced diagnosis system that uses microfluidics and machine learning. Auto-enricher analyzes patient sample using AI to identify infections and predict effective antibiotics. It can provide results in around 20 minutes with around 95% accuracy, helping doctors choose treatment faster and more accurately. It costs around $1 million in the first year for implementation, followed by $50,000 per year for maintenance over the next 2 years. We also include doctor ethical testing costing $80,000 and upskill training costing $300,000 to improve responsible antibiotic use.
Aside from the filtration and hospital management, we also need a sustainable counter to another drive of AMR, flooding, by investing the remaining $1.72 million in a mangrove restoration project along the coastline. This project has been implemented in cities across the world, such as Shenzhen, to act as a smart city and have proven successful as a first line of defense against flooding. Year 1 starts with a $980,000 capital investment to get the forest in the ground. This includes hydrological dredging and planting 250,000 mangrove saplings, which creates a dense root matrix that absorbs contaminated floodwaters out of the city and restores the aquatic ecosystem. The remaining $740,000 cover 4 years of operational maintenance and monitoring of water turbidity, screening for high-risk resistant bacteria, and ensuring an 85% sapling survival rate to create a massive biological filter which naturally settles suspended solids, trap the heavy metals that drive microbial resistance, and break down organic pollutants. By year 4, our collected data will establish a concrete baseline for the city's long-term health and flood strategy and transition the mangrove into self-sustaining model.
From the stakeholder perspective, our project has been both supporters and affected groups, public health agencies, the EPA, and the Hospital Association. We support antibiotic stewardship because it reduces AMR, improves public health, and lowers environmental contamination.
Community organizations also benefit from better rural healthcare access, cleaner waterways, and improved sanitation during flooding.
Urban planning development supports the mangrove project because mangroves act as a green infrastructure and naturally breaks down pollution. However, some groups may be affected. The Department of Finance may worry about high technology costs, but targeted treatment is cheaper than upgrading the whole wastewater system.
Pharmaceutical manufacturers may oppose stricter discharge rules, whilst livestock producers need time to adjust to reduce antibiotic use.
In conclusions, our 10 million strategic interventions transform Santara from a region vulnerable to antimicrobial resistance into a global leader in biosafety and climate resilience. Antimicrobial resistance is not only a medical challenge, but also an environmental and societal threat that demands urgent coordinated actions. Santara strategies addresses the root causes of AMR through a comprehensive approach that combines responsible healthcare practice, advanced diagnostic, wastewater technologies, and nature-based climate solutions.
This plan tackles AMR from multiple angles under a unified One Health framework by protecting public health, preserving antibiotic effectiveness, improving environmental resilience, and safeguarding future generations through collaboration between
government agencies,
healthcare institutions,
Industries.
and communities.